Good afternoon, everyone. Thank you for joining today's Public Health Discovery Seminar Series. My name is Cassietta Trewick. I go by Cassie. I'm one of the admission counselors here at the City of Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University. And today I have the honor of introducing Dr. Kristefer Stojanovski. I hope I pronounced that right. I hope I didn't butcher it. I've been practicing on it. But he will be presenting his Public Health Discovery Seminar Series on practicing humility and decolonism and global public health. We will open up for a Q&A session at the end, so please feel free if you have any questions, drop it in the Q&A, and if you can't stay to the end, still drop those in the Q&A chat as well. And so I'm going to let Dr. K take over.
Thank you, Cassietta. Pleasure. Hey, everyone. I'm Dr. Kristefer Stojanovski. I know it's a tricky way to say it. Don't worry about it. It's Macedonian by ethnic origin, but I'm happy to be here with you all. I would love to know who's in the room. I see there's 23 folks here. If you could just say hi in the chat, where you're coming from, what year and schooling you're in, or what you're up to. It would just be, yeah, lovely to know. I see lots of names. So, welcome everyone. So it's gonna be a lot of talking and sharing. I'm also gonna hopefully ask folks to like come off mute. Or I don't know, can you come off mute? I'm sorry. You can use the chat to engage in some of this conversation. Thanks, Susanna, joining me from upstairs, Myrtle Beach. Great, great, great. Thanks, Lorena. Hi, Chloe. Yes, welcome. Hi, Stephanie from Tulsa. Thanks for saying hello, everyone. I see some folks in the Q&A as well. Mia, Philadelphia. So I just want to share a little bit about who I am. So I'm a global health system science scholar. And what that really means is I try to leverage our understanding of not just studying one particular issue in isolation, but how to, the way our world is structured, really shape our health and outcomes across the globe. I do a lot of things on LGBT health globally. I also work on sexual reproductive health issues and, just to humanize myself as well. I'm not just this professor and researcher. I'm also an uncle, godfather, simple, friend, a human, simply human, trying to navigate this world in a way that feels right with my values, which is really what we're going to talk about today. So thanks for everyone. Continue to say hello, Chris, Michael, Ayula. I hope I said that right, from Nigeria. Welcome. Hi, Peggy. So today, this is kind of what we're going to do for the next 20-ish minutes, 30-ish minutes. And then just going to offer us a lot of space towards the end for discussion, just questions and things like that. But I want to spend some time defining some of these terms, provide some examples of colonialism and the impacts on health throughout history and why it's important to be a bit more humble and practice humility in this work. And then thinking about how all this applies to public health and like how do we actually practice humility and decolonialism. Thanks for continuing to say hi. Hi, Gideon from Kenya. Welcome. I do some work in Kenya, so excited to talk about that. Kurt, welcome from Michigan. I'm a Michigander, so that's exciting. Here's a question for everyone. What do you know about global health? And I know this is a very broad question, but just whatever pops into your head in the chat, please just put that in there. When I ask about what do you know about global health, what is kind of running, what's coming through your mind? Diana, yes. Diana, it's complex, 100%. Yes, it is complex. Lorena, thank you for putting collaboration between global north and south. I think the word you used here is so key, which is collaboration. Mia, acknowledging interdisciplinary relationships, 100%. We're doing this together. Oh, Susanna, yes, a very problematic history. which I think is like really the crux of my talk today. How do we do public health in light of that really problematic history? Lucy, yes, the social determinants. Neo-colonial. Yes, Ryan, this is the new form of colonialism, 100%. So keep putting those in the chat. Thank you, everyone. The Summit, the World Health Organization, yes, huge player. I'm not going to get into it very much today, but also, has some of its own problems of colonialism. So, some definitions. So, colonialism, we've all heard the term, I'm sure. It's been a big word, or we're big words over time. But I really want us to offer this like concrete piece, and I'm using it from Wikipedia, but I really liked this one, which is the practice of extending and maintaining political, social, economic, and cultural domination over a territory and its peoples by another people in pursuits of interests defined in an often distant metropole, just a metropolis somewhere else, who also claim superiority. So when we really sit with this term, it has implications for the entire world in which we are existing, in the way that the field of public health is practiced, our training, our theories, our frameworks, and all of that is in service of Western global northern nations. I'm talking about France, I'm talking about England, Portugal, Spain, the United States, who have over time practiced extending and maintaining political, social, economic, and cultural domination over a group of people that were considered subhuman and let's just say completely dehumanized. Then, given that this is now our starting point, what do we do to address this? How do we practice public health without continuing to replicate these types of systems, this type of domination over the political, social, economic, and cultural aspects of people's lives that we are working with in that behalf of? So decolonialism is then the opposite of colonialism, which refers to the process of undoing the legacies of colonialism and striving for the political, economic, and cultural independence of formerly colonized nations. This is an action. It is not just a word. Given that colonialism was a practice, we now must also practice decolonialism, which really means giving up power, resources, money. And unfortunately, that's just not how our world is shaped today. And so what do we do as public health practitioners? Those of you who are new to the field are really exploring this as an area of interest for yours or career. How do we go about doing this type of work? And so I asked this question to you all. Given these two definitions, what must we do as a society in order to truly practice decolonialism? And please drop just ideas in the chat. And don't be shy. It's not going to be any one thing. Yes, thanks, Mia. At a minimum, we really need to acknowledge the uncomfortable histories, work on cultural competencies. Yes, thanks, Dina. And I would also say for that one, I'm gonna change the competencies to humility, because and let me just share a bit more of my insights to that. There is no way I, as Dr. Kristefer Stojanovski, will be competent in the culture of Kenya. I will never be competent in the culture of Nigeria. I'm barely competent in the culture of America. Let's just be real about that. So I want us to be more humble in our understanding, in our capacities that I, as a professor in the United States, cannot possibly ever be competent in any other person's culture. Yes, thanks, Dina. Checking our privilege and acknowledging what we don't know. 100%. Like, we know what we don't know. We know what we know, but we don't know what we don't know. And that's always the hardest place to be. And I think for today's talk, I really just want us to sit with that. We don't know what we don't know. So how do we be humble and do this work differently as global persons who are interested in global? What else is coming to your mind? Add more seats to the table, or even step out of our own seats. Yes, make space for others. In Hishi, I would even say, how do we just build new tables? Maybe, you know, sometimes some of these tables are very old, and it's time to maybe update them and get rid of them, because we know who's been sitting at them forever. Kurt, how do you recommend describing the cultural context of workplace and community discussion? Kurt, I think, you know, something that you want to think about, or the way I just framed it here is that, like, what does it mean to be culturally competent? Competent means like I am gaining some level of skills. I am meeting some quote unquote criteria. I am checking some boxes that says like I have now achieved this knowledge and these skills. Humility is recognizing that there's no way for me to possibly ever know everything. And so how do we practice in that way versus saying I'm trying to be competent and acquire said skills? Confront the inevitable. Yes. Change the agenda setters. Yes, 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 yes. Thank you, everyone. So I just want to spend thanks for this great conversation. I want us to, I'm going to now go into some examples of how society in colonialism has structured our current world, and then thinking about, you know, how do we do this work? So some of you might know, some of you might not know, that there is this inextricable link between slavery and the banking industry. So, you know, when we all think about colonialism, we often think about the enslavement of Africans, who were then brought over to the US, to Europe, into Brazil, into the Americas, as a big colonial project. And that is 100% true. And to make that whole project feasible, so many different actors had to all work in tandem to make that happen. And so there is a lot of recognition of harms, let me say. Someone I think mentioned it, kind of acknowledging the uncomfortable histories. That is the first step, right? And so, but what do we then do to practice decolonialism? So here we have folks like Barclays, which is a bank in England, HSBC, and Lloyd's. These are some of the largest banks in the United Kingdom who were all participating in slavery. We have hidden links between slavery and Wall Street. So we have banks like Bank of America, Chase, Citizens Bank, Wells Fargo, Wachovia. We have banks like BNP Paribas, which is one of France's largest banks, who were all in on participating in the enslavement of African people and moving money around for enslavers. When we sit with this history, and then when we think about some of the work we do with the Global North and Global South, and we know statistics around kind of economically, whereas Africa as a continent, you know, certain countries are certainly doing better than others. But when we do a global comparison of, you know, North America and the European continent to African continent to the Asian continent, we see vast wealth inequalities. All of that is related to the enslavement of Africans when we're talking about the African continent and the existence of these banks who worked in supporting the enslavement of Africans. So when we think about today, when we practice about working in low resource settings, we really need to ponder and sit with ourselves about why these countries that we're working with are quote unquote low resourced in the first place. And that's because people were trafficked, land was stolen, minerals were taken away. So then it should be no surprise that we are working in really challenging contexts for global public health. Right? They will be resource constrained because we stole everything. I want to share another example, the field of gynecology. I'm hoping you can all hear this video when I click play. So some of you all might know about, there's a man, I can't remember his name. He's a white man, something Sims is his last name, who's often noted as the father of gynecology. But it's a deep sordid history of how this man goes about doing all his research when it comes to the field of gynecology. So the field of tropical medicine also has a sordid history rooted in colonialism and racism. So some of you all might not know that Panama Canal here that connected the United States to the rest of the world for us to ship our goods and make more money without having to traverse all the way to the bottom of South America is also related to histories of colonialism. So a little quote here, tropical medicine when used to illustrate minoritized workers' alleged laziness and lack of hygiene that was, according to racial essentialist conceptions of contagion, causing diseases to spread. So there's whole histories here of tropical medicine. We can think about the COVID-19 vaccine, or COVID-19 infectious disease. I do some work in Eastern Europe where Roma population, so it's a big ethnic minority in Europe who are very dark-skinned, racialized, who are seen as communities of disease and spreading COVID. And quite literally were shut out of society, could not leave their communities by various government authorities in Eastern Europe. I think there's a book called Necropolis that you all might find interesting that really just gets into this kind of discussion of yellow fever and the implications for the economies here in the South. So I share that. It's a really interesting read. And kind of just lastly, just, as to lift up some of these examples, I do a lot of LGBT work, and a lot of us, when the rhetoric of the West is, oh, how horrific what's happening with LGBT persons in Africa, the Ugandan law, for example, that criminalizes LGBT people. Ghana has something similar, Nigeria as well. Well, those laws themselves were actually introduced into many African nations during the time of colonialism and completely erased LGBT Africans' histories and tapestries. And so this, the modern day Uganda can trace back those laws to the colonial legacy. We have similar issues in Kenya, Rwanda, Ghana, Nigeria, where British and French governments introduced anti-sodomy laws, right? So criminalize the behaviors of LGBT people. And there's a whole bunch of papers on this that you all can read about more. I'm happy to share these slides. And so we have to really contend with this history, and I do it a lot when I'm doing my LGBT work, really understanding where this anti-LGBT un-African rhetoric has really come from throughout history. And so now to move us in what to do about all this. I don't want to just sit on the problems. And so I sit with the concept of cultural humility here. And so humility comes from the Latin root humilis, which means lowly, or from humus, meaning earth. And it really signifies being grounded, realistic, and aware of one's place, recognizing shared humanity rather than superiority, allowing openness to learning and growth, and often involves service to others, contrasting with things like arrogance, supremacy. And I really appreciate this taking it back to the Latin root, because it really means how are we close to the earth and being, grounded, rooted, back to this thing that literally sustains all of our lives, which is the earth and the planet. And so what are some ways that I practice decolonial public health in my work? And I'll share some resources as well. Really, in all of my work, I'm there to listen and support.
In all of my work now, I really don't lead anything. You are seeing me here as a professor. We are often trained that we have to develop this independent program of work, but nothing happens independently. And so when I think about the work I do and the communities I engage with, the organizations I work with, I really ask them questions around like, what is it that you all need from me? How can I be in service to you all? And so I'm really sitting there as a supportive team member, offering insights, but not holding the reins by any means. Sharing and build capacity is a big part to all of my work in global health. And I specifically say share capacity and not just build, because I have a whole lot of learning to do as well. And that comes back to this practice of humility. As I enter into new spaces, working in different cultural contexts, um, for example, learning about these colonial histories in Africa related to LGBT people was a huge learning for myself. And then recognizing how we are here today, um, you know, why are all these laws happening in places like Uganda, Kenya, um, Ghana, Nigeria? All of this has a long shared history with colonialism. Another piece is while we wait for reparations, how do we move money towards communities and people who need it? So here I'm a professor at Tulane, a pretty well-resourced university. I have some, research dollars, and I really am intentional about how and who gets paid with that money. Have a whole lot of collaborators in Kenya and Rwanda where I'm quite literally spending those dollars and paying salaries over there versus thinking about this from on this side of the ocean. And mutuality and interdependence. Some of y'all mentioned this in the chat already. Really, like none of this work happens without collaboration, without teamwork. How do I recognize that I am connected to histories and stories that I can't even imagine, and let those kind of be the guiding lights in thinking about how do I interact with others in the communities I work with in a way that's full of interdependence and collaboration and mutuality. And I just here want to offer some cool resources. There's this group called the Decolonizing Wealth Project, which I think is really interesting, the work they're doing, which is how do they kind of move $1 trillion to address issues in lower resource settings. Another book I really enjoy, Decolonizing Wealth, which I think is a whole fascinating read, thinking about our whole field of philanthropy and foundations, and offer some critical assessments of how that's being done. And a book that I'm really enjoying right now is Aid on the Edge of Chaos, which is really thinking about the complexity of doing international development and again, critiquing, but also offering some resources of how we maybe need to shift and do that differently and better. And some more before we get into discussion, just some great reads, I think, for you all to have, some on decolonial research methods, a lot of mutuality, thinking about lived experience. And this last one I just shared, the spectrum of community engagement to ownership, I think is a really, really cool tool. I love it a lot. I use it, which is how do we ensure that communities own all of the work that we are doing, are not just providing insights into surveys or serving as an advisory board, but like I said, getting paid for their work. There's agreements in place. We have contracts. They own the data. Really, really different ways of doing research than has been our typical way of doing this work. So that's what I leave you here with. We have lots of time for discussion. Thank you.
Thank you so much for that wonderful Discovery Seminar series. I was just in awe that you actually highlighted that monument that is in Montgomery, Alabama. I've seen it in person. So if you ever get a chance, everyone, to travel to Montgomery, Alabama, I can definitely tell you that that monument is so powerful when you see it. But we're going to open it up for questions. You can drop your questions in the Q&A or in the chat. And I think you got a question right now. It says, can you repeat the second book after the Decolonizing Wealth?
Aid in the edge of chaos? Aid on the edge of chaos, sorry. Dropping in the chat. And thanks for with the claps. Yes, Cassie, thanks for sharing about the monument. Very powerful. If y'all ever find yourselves in Montgomery, you must go to the Legacy Museum, the Sculpture Park, and I think, something thinking about decolonialism from this talk, like the most fascinating part to me about those spaces is that they are owned by the Equal Justice Initiative, which is a Black man who created this whole organization around criminal justice, and not just criminal justice, but equal rights. And so because they own it, it's private, all of this political moment we find ourselves in, let me say it that way, like they own it, so none of that stuff is changing in that museum. None of those sculptures are changing, right? It's not like the African American Museum in in DC, where exhibits are being changed because the federal government is funding that museum. And so, I really appreciate them quite literally owning land, the land that the Legacy Museum stands on, the sculpture park, the National Monument, and so many other things. And they are breathing life to the true histories in Alabama, but also what we currently call the United States. And remember, this country is not young. There were people well before us in 1776. So like everyone says, this is a young nation. There have been nations here for we don't even know how long.
Thank you so much. Yes, yes. So definitely, if you are able to, if you're definitely able to go to Montgomery, Alabama, please go to that museum. So we have a question. Someone sent it to me anonymously. What is the one thing that a white person can do to aid in helping people of color, especially with the current climate we are in with this administration?
Mm-hmm. Thanks for asking. And I sit with that as a white man, white presenting man, sometimes not. People confuse me. And I think you've heard me say some of it. Part of it is I am recognizing these little levers of power that I have as an assistant professor. For example, knowing the wealth gap between the United States and Kenya, which is a major area of my work. How do I participate in my own form of, let's just, reparations, where I'm quite literally spending those grant dollars with researchers in Kenya, working with them where they're like getting mentorship with me, training, resource building, skill building, and quite literally like the money is being spent there, taxes are being paid there. I am not using the money and moving into pockets that already have money. There's one concrete example. I did not recognize that power until very recently. And so that's been something that's been interesting for my own learning, that I'm doing in a more concrete way. Also, like lifting others up. Like, I didn't come from nowhere. My parents are immigrants. My grandparents, they never went to college, lived in tiny rural villages back in Macedonia. They were milking cows and raising chickens for food. So I fully recognize that like I am standing on so many shoulders that I don't even know. And how do I also act as a shoulder that others can stand up? And like, it'd be very remiss of me to not bring others along with me as I move along whatever we want to call this thing, the corporate ladder.
Thank you so much. Do we have any other questions? Please feel free to drop them in the Q&A chat or in the chat. We have a question in the chat. What is your opinion on parachute science or neo-colonial sciences? How do we stop this practice when we don't often have the power to do so?
Yeah, that is a good question. You know, I think first I want to say that we have a lot more power than we think we do. And I don't ever want to cede power. That is part of the colonial infrastructure to think that one doesn't. And so just in the way I practice my research, the way I conduct it, I've had my partners in Rwanda and Kenya quite literally say to me, they're like, we've never worked with someone from the global north who does things the way that you do, like, which is super rooted in sharing capacity, mentorship, skill building. Like I said, contracts, like, right? Who am I signing contracts with? Whose salaries am I paying? You know, who gets to put food on the table because I am doing the research in the way that I do the research with the communities that I'm doing research with. And I don't take that lightly. Like, this is like one of my partners, he's a young man, young gay man, trying to gain some skills, wants to go to nursing school. Been in touch with him for a couple of years. And I was like, I would love to be able to help you with nursing school. I don't have funds for that, like to just pay for your nursing school. And then I was like, but wait a second. I have research projects that we need to get things done. And so now he's like part of the team doing focus groups, transcribing transcripts. I'm paying him from the research dollars. He's using that money to go to nursing school. This is like insane to me. I never thought that this would be my job, that this is the impact that I would have on people's lives. Like, and that's just one human. He's in a family. Like that, you know, what that is doing, I don't know behind the scenes, but I know it's a whole bunch of good. And that is exciting to me. I'm trying to figure out ways to do more things like that, to move money in those ways and things like that. But I think like that is a very tangible, concrete power.
Got some more questions. What advice do you have for others who are working in this field as a current DRPH student in IJC?
Mm-hmm. And I see some others in the chat too around like what keeps me going, what inspired me.
Yeah.
So biggest thing I would say at this moment, and I see, you know, this year has been super hard. Yes, yes, especially, you know, I am at the nexus of like global health, which like, you know, we gutted everything. We made another colonial decision, right? Here's this government, the United States, where like we quite literally extract wealth from many African nations through oil, gold, minerals, things like that. And then the money we were providing international development and aid is now stripped. But I don't know if most people know, like 70% of all USAID dollars was being spent on US companies. So that stuff wasn't even going to the places that we are all wanting to support and like enhance the living and health of those nations. So we're spending billions of dollars to do all this work, of which 70% of those billions of dollars is going to US-based companies, not places in Kenya, Nigeria, Rwanda. But I'm not saying that the harm of that extra 30% being lost, like that is also very real. And so I say all that to say is I don't know where this moment's going. All I know is like, just keep doing the work. Some things that I've had to do is like stay out of the nonsense of it all. Like it is what it is. Like the money's gone. I can't change that. New money's popping up. I'm still very passionate about the work I do and the way I do it. Like I'm not leaving communities I work with behind. Like that's nonsense. That's not even an option. But I think it gives us a space to be more creative around how we do this work, more mutuality. So a lot of the work we're doing now, like we're pulling money from all these different resources, and now all of a sudden we got this pot of money to do these projects. And I think that's super neat. We're not relying on these big funders and things like that, but yet somehow things are still moving forward. And so, and I take inspiration from the communities and community organizations I work with. Like there's an org I work with in Kenya, in Mombasa, in the coast of Kenya, who's been doing a whole lot of anti-stigma interventions for like 6 years with healthcare workers and imams and priests and police officers, and it is having an impact. And like they didn't have millions of dollars doing all this, but they saw a need and they're getting into it. And so it's really inspiring for us to just think that like we don't need large swaths of money to get things done. I'm looking at some of these other questions. What inspired me? Yes. How did I get started? Yes. Okay. So thinking about this was a long road of how I got here, of which I had like no idea about the field of public health. So, as an undergrad at the University of Michigan, I always thought I was going to go to med school. Was doing all that pre-med stuff. And then I was like, these are like not these are not classes for me. Like they were like my grades were not the best in those classes. Like, I'm getting like B minuses, a C. Like I was like, clearly something's not clicking here. And so I started then getting into classes in like anthropology and public health, and like all of that was like way more exciting to me. Yes, Tina, yes. So in like towards the end of my undergrad, I'm taking all those classes. And then, I graduated during that 2008, 2009 terrible financial crisis, because that was our world. I'm a millennial, so we like always experience financial crisis. Like we got all of them. And so I was like, well, I can't go work because there's like no jobs. So I went and got my master's in public health. But what started happening is like doors started opening. So like I had an internship for my practicum where I was with the World Health Organization in Serbia, where I was analyzing data, doing as an intern, publishing papers. That got me super interested in. And then like as I started beefing up those skills and analyses, writing, things like that, I started getting those types of jobs, which were really exciting to me, like coordinating studies, an analyst job, doing some consulting work with like social justice firms and like doing evaluation projects. And things just started like snowballing. Like then, like one of my colleagues, we did some project with the World Bank in Kosovo on like maternal child health. And then like this other thing. And like I think it's like not chasing, but like following the leads, following your passions and what doors are opening. And like all of that just started growing and growing. And now here I am, this professor at Tulane, doing global health work still 14 years later. And it's really, really exciting.
Got some more questions for you.
Yeah.
How do you navigate language barriers when working with communities in other countries?
Thanks for asking that. I think that's, again, being humble. This is why I do everything in partnership and collaboration and mutuality. Like I know I don't have the skills to speak Kiswahili or Kinyarwanda, and like let me just own that, right? Let me also own that like there are times where yeah, I'm just gonna be uncomfortable because I have no idea what people are saying. They might even be trash talking me, and whatever, it's cool. That's like fine. I'm not to be privy to your conversations, right? Because I don't speak the language. But I think that's where, again, partnership, collaboration. I don't do any of this work alone when I'm in Kenya, Rwanda. It is all through local partners. So all the things we're translating documents, all of that's happening. When we're in meetings, there's always folks that are speaking Kiswahili in Kenya. I'm even starting to learn some Kiswahili, and it's fun to be in meetings where like I can make cultural context like little jokes and things like that, or people have even said that to me. It's really refreshing to have a researcher from the US like embed themselves in our culture and make and speak in that way too, and like jokes in that way, versus not engaging in the culture. Like, I don't even think that's an option.
Another question that we have, I had no idea about the banks. Are there resources you can recommend that help people avoid using services from companies that have supported colonialism / slavery in the past?
That is a great question. I don't know that there's like a handbook or any of that kind of stuff. Um, I just like, honestly, I took an interest in all this and just engaged in my own learning, sort of researching things. When it came to the banks, like, you can think about credit unions to work with instead, which are generally always also better. What are some books? Like, there's a book called Medical Apartheid. Let me get it. I can put it in the chat. Medical Apartheid. I think it's, yes, I think this is it. While I pull that up. I am not going to share with you the Amazon link. There's some intentionality there. There's a book. You can learn a lot about this in the health medical field. What's in there? Well, I'm thinking of these things. What other questions are out?
Do you think even with continuous work, breaking into this public health career, or instead is going to get better, especially with the current climate?
We are going to be in this climate for a minute, for a little while. But I'm also of this optimistic mindset too, a bit, where as we start to see things break apart, I think people are going to realize how much public health is important to their lives as vaccine rates are going down in this country. And I think as folks breaking into public health and gaining these skills and expertise, like, there is so much work to do here and ways to carve out a niche. Like, here we are in this whole like Make America Healthy Again movement. And listen, we can all get behind that. I don't think anyone's like, yes, let's keep America unhealthy. Right? Now, do I support the influencers and everyone behind it who are like not even speaking truth in science? No, I don't. But that is certainly where everyone on this call has a whole space to work through. And like, how do we make our voices louder? How do we create echo chambers as well of truth? Let me say it that way, like where we are doing this work in a way that's truthful and honest, and not stealing of things in capitalism and all that. But I'm sharing some more books. I see questions, so I'm just like sharing some books that I've read and like.
I think that was the last question. Any other book recommendations? I'm new to the field and really want to learn more.
I saw Peggy, you did have a hand up.
Yes, Peggy, I saw your hand. If you have any questions, because this is a webinar, if you have any questions, please feel free to drop it in the Q&A chat or in the chat. Okay.
I really like this last book I put in here called Weathering the Extraordinary Stress of Ordinary Life in an Unjust Society. Super good book that really digs into like how quite literally all this racism, sexism, patriarchy, all these stressors, like quite literally like changes the epigenetics of our bodies.
Thank you so much for those book recommendations. I've actually copied some of the links and put them in my notes as well. Please feel free. We have 5 more minutes of the Public Health Discovery Seminar Series. Please feel free to ask as many questions as you want. I'm going to drop in the chat Dr. K's email just in case, you're like, I want to ask him a question, but not in on the webinars. I dropped his email in the chat. We have another question. As someone with over a decade of experience in this field, what would be your advice about someone who's trying to combine community health with health policies on the grad level?
Yeah, I would say pack your patience. Policies don't change overnight. It can be a long time coming, but also you need to be ready for it when it does come. And I say that because we often look to policy to be this ever-ending solution, but it's never going to be one policy or anything like that. It's going to be a multitude of them. And in this current political climate, the national political climate, I would also suggest you act more locally at this time, where there is a lot of power to make change. Here we are, I'm in New Orleans, Immigration and Customs Enforcement is in Louisiana. And I say that on purpose, in Louisiana. Do you know where they are not really operating that much? In New Orleans. They are in Kenner. They are in Metairie. They are in other counties that have a different perspective about the constitutionality of what's happening. There's a lot of places where local power has a lot of power, right? If we think about some of criminal justice reform, I worked in criminal justice reform. You have district attorneys and judges who can quite literally change a whole criminal justice system, right? Those judges are not elected at a national level. Those are at state levels, or even if they're a circuit court, or just those are at more local levels. And so there's a whole lot of power happening. The utility boards, those are those boards that make our utilities cost what they cost. There's a whole lot of power in that board to set prices. And so don't just think of this nationally, think super locally, find who the right people are, who can take up your cause. Partner, collaboration. You are not alone. We are only one human. We cannot carry the weight of the world upon our shoulders. We will quite literally be buried and die, according to the Weathering book that you will all read and learn more about. So no, we cannot do that to ourselves and to each other.
And on that note, I think that is a beautiful way to end the Public Health Discovery Seminar Series. Thank you all so much for joining today's Public Health Discovery Seminar Series. Thank you so much, Dr. Stojanovski.
You're welcome.
You all have a wonderful day, and tune in to our last Public Health Discovery Seminar Series that will be next Monday. And thank you all so much, and take care. Bye.
Bye, y'all. Thank you.